Hi, and thank you for joining me. My name is Penny Rodriguez, and I'm currently a Doctorate of Nursing Practitioner student at Gonzaga University here in Spokane, Washington. I am also currently a registered nurse in Washington State. Today, I'd like to discuss the dramatic increase and importance of diabetes in our society and the impact policy has on prevention, education, and treatment of this disease. Diabetes is a chronic long-term disease impacting the lives of many in the healthcare arena today. Healthy People 2020 has identified the need to reduce the diagnosis and economic burden of the disease by working with those affected with diabetes. More specifically, they focus on education and prevention of those most at risk in Washington State. Many federal policies involving the disease and prevention of this chronic disease in general highlight this important topic. The Affordable Care Act, also known as ACA, is very focused on the prevention of chronic diseases like diabetes and will be the focus of this topic. The American Association of Diabetes Educators, beginning in 2014, highlighted that ACA provides coverage for prescriptions, routine screenings, as well as nutrition management for this disease. The CDC reports that diabetes is on the rise with 1.9 million new cases yearly, highlighting the need for focus on policy and supportive prevention. Diabetes prevention and education is the key to reducing the skyrocketing numbers of those affected by the disease. Here in Washington State, a higher number of diagnosed Native Americans and Hispanics provide for a cultural gap, language barrier, and complicated access to necessary resources that could significantly reduce diagnostic numbers. As future nurse practitioners, we can help shape policy to assure that those at risk receive the education and care they need to manage this chronic disease. I am encouraging everyone to collaborate together through nursing scholarship to encourage social service, religious, educational, as well as healthcare individuals support those to try to reduce this incredibly high epidemic that's happening here in Washington State. Without such efforts, dollars funded for treatment of diabetes is going to continue to skyrocket, with an estimated $5.39 billion additional dollars needed to be allocated over the next 10 years to treat those affected. In order to better support those individuals with diabetes, aside from the obvious contributions of assisting with obesity and diet, prevention needs to be supported around disparities that include those language barriers, health literacy and considerations, financial considerations, as well as other diagnostic cultural concerns. So again, working together to better understand the ACA and to support those involved will help to increase prevention and education and reduce the disparity and diagnosis of those affected with diabetes. Thank you so much for your time.